Our guest speaker is a surgical oncologist, a personality development and wellness coach. He finished his medical education at De La Salle University, finished his master in business administration degree in Ateneo. He is also an on-demand international speaker, been to different countries. Just like right now, he's doing a lot of Zoom meetings. So please welcome my trusted best friend and our eldest brother, Dr. Roel Tolentino.
Thank you to my favorite sister, kasi siya lang ang sister ko. Anyway, magandang araw, magandang gabi, magandang hapon sa inyong lahat, sa anumang parte ng mundo. Now, we have very important bacteria inside our body, and we have to sustain the good bacteria inside our colon, our intestine, by taking food supplements with bacteria. For example, like this one, milk with lactobacillus. This good bacteria is very important inside our colon to diminish the growth of the bad bacteria. Kailangan mas marami kang good bacteria. And did you know that bacterial cells dominated by colon bacteria? We have 40 trillion bacteria inside our body. Most of them inside our colon. Ulitin ko na, ito, madalas ko itong madinig sa mga lectures. Our body is composed of more or less 40 trillion bacteria. However, the human cells is just about 30 trillion. No? Kaya huwag mo sabihing malinis ka. There are more bacteria than your human cells inside your body. Surprising. Buti na lang buhay tayo. This is the human skin on your left. And on your right is human blood cells. Staphylococcus cell is very small. Ayan. So tandaan nyo, yung human cell malaki. However, those bacteria are very small. Katulad nito, Staphylococcus aureus cell. This Staphylococcus aureus bacteria, they inhabit our skin, our nose, our lungs. So punong-puno tayo ng bacteria. Maliliit lang sila. Kaya yung bacteria outnumbered our human cell. Kaya kailangan natin ng balance. Kaya minsan pag nagkasakit ka, if you have immunity problems, you are overpowered by this bacteria. No? Tanungin nga natin si Dr. Si Dr. Sino ba mga nandito? Participant. Dr. Lopez. Ano ba yung bacteria na kapag humina ang katawan mo sa ospital, dumadami? Ang tawag namin doon, these are called opportunistic bacteria. Ang example niyan is Pseudomonas bacteria. Kapag ang pasyente matagal na sa ICU, immunocompromised, the patient will be infected by an opportunistic bacteria called Pseudomonas bacteria, and this will cause pneumonia, urinary tract infection, skin diseases. No? Nung ako po ay fourth year clerk, na-infect po ako sa ngala-ngala. So nagpa-check po ako, Pseudomonas ang lumabas because of my exposure to the patients when I was a medical student. Good bacteria versus bad bacteria. We increase our good bacteria by taking supplements, by eating more vegetables, not meat kasi ang vegetables are very good for the growth of the good bacteria, mga prebiotics. And we have different kinds of bacteria, no? So, most important is the lactobacillus. Yan. And bad bacteria, Campylobacter. Anyway, for the ano lang yan, medical students. And also, in women, the vagina, it has many bacteria, no? So it's okay lang yon kasi yung good bacteria ng vagina is very important to ward off mga fungal infections, ano pa, yung mga bad bacteria, kaya ang okay lang yon, no problem. This one is, for example, when you took an antibiotic, no, what will happen? Your good bacteria in the body, kasama sa vagina, okay, what will happen? There will be a decreased amount of good bacteria. Nagkakaroon ka ng vaginitis. Nagkakaroon ka ng fungal infection of the vagina. And in the throat, you have fungal infection. Kaya importante po, do not take antibiotics without proper prescriptions. Because if you abuse yourself with antibiotics, what will happen? There will be overgrowth of fungi in your body. Ano po ba yung mga, ano ba sa Tagalog ng fungi? Ano ba sa Tagalog? Ano ba yung nasa, sa bread? Ano yung nasa bread? Inaamag ka. Yun, di ba? Amag. Aamagin ng katawan mo. And you will have fungal infection also of the skin. Ayan. You will have yeast infection. What is yeast? Amag yan. Fungus. Kaya yung after taking about 7 to 10 days of antibiotic, what will happen? The women sometimes will have an itch in their private parts because of yeast infection or fungal infection. Cilia, number 3. Tandaan nyo cilia. Yung cilia natin, we have cilia in our body. Ano po ba yung cilia? They are very small, hair-like organs in our bronchus. Ito, bronchus. Nose is lined with hair and mucus to trap dust and dirt. So through evolution, nagkaroon tayo ng hair sa ilong, in order to trap bacteria, viruses, and tandaan nyo, yung trachea down to the bronchus is lined with cilia, tiny hairs and mucus for the same purpose of trapping dirt and expelling the dirt in our throat. Then we will just swallow it or cut it out. But the problem is when you smoke, lalo na smoking, you paralyze this cilia. Okay, and inside our respiratory tract, mucus contains lysosomes, enzymes that destroy bacterial cell walls. Meron pong yung mga laway natin, mucus ng ilong, yung mga sipon, yung mucus ng ngala-ngala, mucus ng ating bituka, lahat po yan merong lysosomes. Kaya ho, yung mga, tandaan nyo na lang, just look at this. We have millions and millions of bacteria in our intestine. How come we are not sick? Because it has lysosomes and there are so many different fighting mechanisms of our body. The normal flow of mucus washes bacteria and viruses off mucous membranes, especially sa nose, sa respiratory tract, winawalis niya. Okay? O kaya iahatching na lang natin. Di ba ang ganda ng katawan natin? Just take care of our body. So if you are smoking, stop smoking. You are destroying your respiratory system. Hair-like projections called cilia line the primary bronchus to remove microbes and debris from the interior of the lungs. So if you have bacteria, viruses, wawalisin nila yan pataas and you will expel the viruses and bacteria. Yan yung sinasabi natin cilia, hair-like projections in the lining of our respiratory tract.